Hi, everyone, and welcome to Wellness Wednesday. It's Carla Coleman, Director of Communication from Columbus, Ohio, with New Salem Baptist Church. And welcome, everyone. Come on into the chat, say hello, start to get your questions lined up because we're going to have a really good, informative message for us today, and someone with us who can answer a lot of our questions about the upcoming the new variants of COVID-19 and how we thought we were out of this, but it looks like we still have a ways to go. We are still deep in the woods, everyone. If you've been following the news reports as well here in Ohio, as well as across the country and across the world, the numbers are going up again. Each week we seem to see another variant here or there. So we have with us tonight Dr. Christopher Brown, who was with us back in April and with a number of our doctors from the New Salem Baptist Church. And Dr. Brown was here to tell us a little bit about the importance of vaccines and, what is this happening as far as the variants are concerned and COVID-19. So welcome, Dr. Brown. We're glad to have you back on the show. We were hoping that if you came back on the show, you would come back to talk about something else, but unfortunately, here we are again. So welcome,
Thank you.
welcome.
Thank you, Carla, very much for that introduction and for re-inviting me. Like you said, I think we really, when we did the last one of these, we really kind of thought that, we were going to get these vaccines, everything is going to go, go down, and we were going to be in a whole different world by this time. And kind of like you said, I mean, unfortunately, we're seeing numbers rise back to what we were at the worst point of this pandemic, and it seems that. I know a lot of people have a lot of questions in terms of, what's going on. I thought we were out of this. But yet again, here we are. So thank you for giving me the opportunity to come back and, help to hopefully clarify some of the confusion that may be out there, answer any questions that may be out there. And kind of like you said, I mean, there's still a lot of people, we've gotten a sizable number of people vaccinated, but there's still a lot of people out there with questions, concerns, and I'm hopeful. Hopefully, I can go through this and we can, help allay some of these fears that people have. So at least, if nothing else, they'll be informed about the decisions that they're making.
Absolutely, absolutely. So I know that you prepared a PowerPoint and some points that you would like to go through. And as always, all of those who've come out to Wellness Wednesdays with us for the past almost 2 years,
Yeah.
we'll have an opportunity to do a long Q&A so we can ask questions and get some of our answers that we've been looking for. So you want us to bring up the PowerPoint now?
Sure, go ahead and bring up the PowerPoint, and I'll talk while you're bringing it
Okay.
up. So basically,
All
what
right.
we're going to be doing today. Oh, right.
We're ready.
Okay. Okay, cool. So basically, what we're going to be doing today is what we call a COVID conversation. And what this is designed to do is to talk about COVID and to answer questions that you may not have been comfortable, um, asking in other venues or with other people. Um, and so that's what we're going to be doing today. Uh, let's see. One quick question right here. Cool. So yeah, so we'll be talking about these things and kind of going through. I'm gonna do a really quick overview. So some of the stuff that's in the beginning is gonna be really basic stuff you've heard before. But one thing I've learned in talking to a lot of my patients is that you can't assume that everyone has gotten correct information about COVID, even a year and a half into the pandemic. So we'll do that. Now, before I give any talks anywhere, I always like to give a little bit of a disclaimer. So yes, I'm a physician, but I always like to make sure that people understand that I'm not your physician. So anything that I present in this anything that I present will be, kind of my own opinions, and is not meant to represent, medical, kind of medical advice, but specifically for you. So what we like to do is just to make sure that you understand that this is for educational and educational entertainment purposes, and it's not meant to substitute for advice you would get from, say, your personal doctor. And then, like I said, so I always want to make sure that people, like I say, you get this information, you use it, but then you also make sure that it's that you talk with your personal physician in terms of getting stuff specifically for you. So we do that, and then also, because I am a member, I have, I work for, a hospital. I kind of have, a number of, side gigs, I guess, and then I'm also on various boards. I always like to let people know that what I'll be talking about today will be, kind of my opinion, and not necessarily representing, either my main company that I work for, the hospital I work for, or any of the boards or anything that I may be a participant in. So we'll do that. So one of the first things we like to do is talk about, COVID-19 and what it is. Okay. So I think that a
Um,
lot of times the, mhm,
Dr. Brown,
uh-huh.
I'm sorry to interrupt you, but we wanted to upload your latest version. So if you just give
Okay.
us a second, and
Okay.
let's just talk general for a second
Okay.
about tell us a little bit about yourself.
Okay.
Just your history here in Columbus and in your
Okay.
practice.
Okay, sounds good. So I guess, yeah, I guess that's a good point. Just kind of introducing myself. So I'm Dr. Christopher Brown. I am actually a kidney and hypertension specialist, and the name of that is nephrologist. I used to start out with calling myself nephrologist, but I realized that a lot of people just don't know what that is. So nephrology is a kidney specialist, and we also specialize in high blood pressure management. I practice, my primary practice is down in Chillicothe. I work for Adena Regional Medical Center. And, I do a number of things, in the community. I do like a lot of community volunteer work and things of this nature. Originally from North Carolina, but I've been up here for about 20 years, actually. Can't believe that. With
Wow,
two young daughters, well, I don't know. They're still young to me. One is 17, the other one is 20. So
excellent.
they're still young to me.
They're
So
young. They're
yeah, so yeah,
young.
so, so one is a senior in high school, and the other one is actually in the Air Force. So she is now
Oh,
serving our nation. So yeah, so we
excellent.
got that going on there.
Hmm.
And kind of like I said, outside of that, graduate of North Carolina A&T State University. So if there are any HBCU Aggies out there, like I said, do
All
like
right
that, do
now.
represent that as well.
Oh,
So
Mike has his
that
t-shirt, his sweatshirt on. Mike's daughter goes there, so
oh, there you go. Look,
Mike.
Aggie Pride is what I'm talking about. So yeah, and I'm trying to think of some other things that are, so those are pretty much the big ones. Also have served, I actually was a health commissioner during 2020. So when that pandemic was primarily going on, I was a health commissioner,
Wow.
which was, as you can imagine, an interesting time trying to manage being a full-time physician as well as the demands of a health commissioner. Fortunately, we had like a very good leadership team at the health department that I worked for, and so was able to, and with technology, it was actually able to complete this, what I think was successfully. I think we all did a really good job there, given the circumstances. But it was kind of interesting. So sometimes I would be dialyzing someone, and then have to jump on a meeting, jump back off, see a couple more people before seeing another meeting. So it was a bit of a doozy. And like I said, kind of thought we were going to at least settle this thing down. We thought we had the magic bullet, but it looks like our
Oh,
mother
here we
looks
go.
like Mother Nature's gonna win.
She always
So yeah,
does. Well,
and
we're
she
ready
always
for
does.
you
She
now.
knows.
So, yep, she always does. So we're ready for you now. If you want to continue your
Okay.
with your PowerPoint, and Mike, you want to put that
Okay.
up?
All right. There you go. So yeah. So COVID-19. So I want to start out with what COVID-19 is. Because a lot of times I found that people use COVID-19 as if it's what's infecting you. COVID-19 is actually the disease, the disease process, the constellation of symptoms that you get. And it's caused by a virus. And this virus is the SARS virus. And it's one of what we call a coronavirus, which, the original three versions of this actually just caused a common cold. But back in 2003, people may remember there was a SARS, there was a SARS outbreak at that point in time. Fortunately, that one kind of dissipated. And this one is actually the second one. And the SARS stands for Severe Acute Respiratory Syndrome, coronavirus 2 is what. And so this disease, this one actually causes this COVID-19 is what it is. And so, so we got this COVID-19. So the question is, of course, how do I get this thing? How do I get this thing? So it's spread, this virus is spread primarily through respiratory droplets that under certain conditions can actually be aerosolized, aerosolized. But for the most part, like I said, they're carried on droplets. So like I said, when you talk, when you sing, when you cough, that virus is in those little particles. And like I said, if anyone is close by, then of course it can, they can either breathe that particle in, or it can land on some of the mucous membranes. So the mucous membranes being the eyes, the nose, and of course, the mouth. And of course, if you're close by and, like I said, say somebody just sneezes into their hand and you shake their hand, of course, you can get it that way as well. So those are some of the ways that you can get this, and you can, under certain circumstances, get it from touching. I know when this was first out, I think people were, bringing their groceries in, wiping down the bag and stuff of this nature. But it's found that, that really is not a primary mode of transmission for most people. So for the most part, I think most people have gotten away from that particular thing. And then, of course, what does it do? So this virus that causes COVID-19, while it's related to, these common cold viruses, it does, as its name suggests, cause a severe respiratory dysfunction as one of its primary and probably more devastating roles within the body. However, it can present in a number of different ways. We're finding now, with some of these variants, that people will come in and they, like I had a patient that came in with primarily GI symptoms, just nausea and lots of severe diarrhea. This person turned out to be COVID positive. She had very little, maybe a little bit of rhinorrhea. That was about it in terms of respiratory symptoms. One of the things that I think is the COVID-19 is known for is the loss of smell. So a lot of people will lose their sense of smell. That still seems to be pretty common with infection with the virus that causes COVID-19 and still continues on. Okay, so of course you want to know how to prevent it, and of course everybody should know this part. At least the first three: the washing your hands, wear a mask, and stay 6 feet. I think that's been drummed into our heads time and time again. And of course now we have the ability to get vaccinated. So the vaccine right now is really, we call it in the public health field, you call it a medical countermeasure. So it's the primary way of preventing from getting from getting severely ill from COVID-19. So I think that one thing that we've found so far is that even though you do get vaccinated, people are like, oh, well, you can still get the disease. And the answer is yes. But, as what we're finding out now is that the people who get vaccinated, those people are more likely to make it out of the hospital either faster or make it out at all, compared to people that don't get vaccinated. So we do have that going on. And then, of course, who does it affect? It can affect anyone, honestly. It can really affect anyone. This first variant that came through looks like what it likes to attack and cause severe illness in is people that are older and people with comorbidities. Obesity being the number one, really the number one comorbidity that it really affects.
Excuse me, Dr. Brown, what slide are you on?
And say it again. Slide 7.
Tell me to advance.
Okay. All right, we'll do. So we'll do that. So yeah, so obesity is really a pretty significant comorbidity when it comes to this particular virus. Next slide, please. Okay. So now one of the things that we're finding, or that we're finding, and you probably heard about this, is something that's called long COVID. And what the CDC, the name the CDC gives it as an official name is post-COVID conditions. And what this is kind of a constellation of symptoms. So, like, so for some people, it might be a persistent cough. Other people's, it might be, an organ, like to the heart or kidney that persistently does not that persistently does not do well or does not go back to pre-infection conditions. So some people got fatigue, malaise, their breathing just ain't right, and this is what we call post-COVID condition. Next slide, please. And when it comes to this post-COVID condition, of course, people want to know how they can prevent it, and that's under study. But it looks like this vaccination may prevent, and for people that actually have long COVID, may actually improve their symptoms. Now, this is still under investigation. I think Yale is one of the places that where they're doing an investigation to find this out. But it looks like this may be something that can go on. One of the things that's concerning about this is that this thing can last months. It may typically the symptoms may last linger about 4 weeks, but these symptoms are really lasting months, and they're causing a lot of for some people can cause significant debility. Next slide, please. Okay. So, when it comes to COVID, of course, one of the things that we're talking about now is going to be the vaccines. And so we have two major types of vaccines. One is the messenger RNA vaccines. And then, of course, they have a number of other ones. The one that we have here is a Johnson & Johnson one. And the messenger RNA vaccine is really a new platform. And I think this is the one that seems to be causing a lot of anxiety in people. And because it's quote unquote new, although it has been studied for probably about 20 years, this is the first time it's being deployed, across a large population. We have two approved messenger RNA vaccines in the U.S. One is the Pfizer, the other is Moderna, and like I said, and right now they seem to be, pretty effective. Next slide, please. Okay. And, in terms of, people always wonder like how the mRNA vaccines work. They're always concerned about whether it gets into your DNA or anything of this nature. And that's not how this works. So what happens is that they have a method of delivering this mRNA basically into the muscle cells. And that muscles and it contains basically some instructions for a portion of the virus that causes COVID-19. And what happens is that instruction goes into the cell. The cell replicates this piece of the virus. In this case, it's the spike protein is what we're looking at. And then, when those spike proteins present themselves, you create an immune reaction to the spike protein so that whenever you get exposed to the virus that causes COVID-19, so say you go out somewhere, that your body will be primed to fight it. This is what it does. So I know some people, there's a lot of rumors and things of this nature that are around there, but this is essentially how this vaccine works. Is that it basically gets your body to make a portion of the virus that it can't spread or anything of this nature, and then your body basically mounts an immune response to it. And so that's how that works. Next slide, please. Okay. So we got the two mRNA vaccines, and then we got a Johnson & Johnson vaccine, which uses it's a special virus called adenovirus. And it uses that adenovirus to kind of go into the cells, and then it uses that to kind of make that spike protein. I know there's been a lot of, at least some negative press about Johnson & Johnson. Some of the stuff that they were concerned about in terms of clotting, they kind of had to hold it from being administered for a while, but then, like I said, allowed it to be used again. It still is pretty effective, around 66% compared to around 93% for the messenger RNA vaccines. Some of the advantages for the Johnson & Johnson vaccine is that this is an older technology and a little bit more what we call stable. so that, this can be used in more, in more rural areas and things of nature. Also, because it's only one injection is needed, it can sometimes it's being used in more vulnerable or more transient populations, because you can give that one injection and then you don't have to worry about coordinating the follow-up injection. Next slide, please. Okay. I think I think we will skip this. So some of the COVID-19 controversies in terms of like its origin and stuff of nature, I think we'll skip that and leave that to the question and answer. And then the next slide is the messenger RNA vaccine. I think we're going to leave that for question and answers too, as well. I think because there's a lot going on there in terms of whether it's microchip, there's a market of beasts and stuff of the nature I've heard of. Okay, and then let's go to the next slide, please. So in terms of prevention, I do want to make sure we cover, the issue of masks, because of course that seems to be controversial. And I want to do it for a couple of reasons. Number one, just to remind people that, masks, even if you're vaccinated, is not what we call a neutralizing vaccine. And what a neutralizing vaccine does is it gets you to not be infected so that you cannot spread the virus. So a vaccinated person, although the transmission levels are less, can spread the virus. And so because of this, we always want to let people know that that masks are still the number one way to prevent this virus from being spread to other people. And in terms of masks, we have several different types of masks. You have the kind of the general surgical mask, like you typically see when you walk on maybe a medical floor. There's the N95 or for the public KN95 masks, which are a little more protective for the person that's wearing it. There are these special nanofilter masks that are out there as well, which are supposed to be actually, according to them, of course, that they're supposed to be more effective than even the 95 mask. You have homemade masks where people are just kind of making them themselves, and then the gaiters, which people wear around the neck and put up, which they actually advise against, because this actually seems to spread things a little bit more and may aerosolize the actual virus. So in terms of like I typically tell people to wear masks. So like I said, so say you're a vaccinated person, you're not as worried about, maybe contracting the virus as other people are, but you don't want to spread. So you take a simple surgical mask or a multi-layered homemade mask and use one of those to prevent spread of the virus to other people. Because what these are doing is that they're controlling that virus within you if you happen to have it. Now, for those individuals who want to prevent from, getting exposure to the virus, that's where we're looking at more the KN95 mask. These masks are going to fit a little more snugly, and they're designed to minimize the amount of virus that you get exposed to. Now, and one thing I do want to make sure that we let people know, because of course some people have children that are going to school and they may be using the homemade mask. Number one, we want to make sure there's more than one layer that are on that mask. And number two, for those individuals that are using the homemade mask, making sure that you maintain very good mask hygiene, which means you should be washing this thing about at least two to three times a week. Preferably, the best thing to do is just have several of them, so that you're not wearing the same mask. Definitely no more than about 2 days. And that's just the main, just so you can keep that mask clean. Okay. All right. Next slide, please. Okay. And now in terms of, treatment, one of the things I do want to make sure that everybody knows is that, there are some treatments for, for COVID-19, especially if you are diagnosed and find this out early. One of them is what we call a monoclonal antibody. And these are manufactured antibodies against the virus that causes COVID-19. But you have to, it's something that you want to use early in the course. So if you start so to give you an example, so maybe you have been out in public, you find out that you were exposed to someone, and maybe you're in a quarantine period and you start feeling unwell. So one of the things you want to do is you want to make sure you contact your primary care clinician to see whether or not you need to get a test. And if you get tested and find out you have it, and you start, maybe, more malaise, maybe a little, maybe question a little shortness of breath, or, possible shortness of breath, make sure that you reach out so that you can see if you qualify for getting a dose of dose or a couple of doses of the monoclonal antibodies. You know, this is not a promotion, but Ohio Health actually has a very good site where you can where they can talk where they kind of talk you through the process of going through the monoclonal antibodies, and also list a number of sites where they are administering the monoclonal antibodies. And so I'll put that down here in the slides there. Okay. All right. Next slide, please. Okay. Other things for outpatient, you know, so one of the things that can happen, of course, the hospitals are filling up. So, you know, for those individuals that don't require hospitalization, you know, there are a couple of things you want to do to see whether or not you can manage outside of going to an ER or anything of this nature. Yet again, call your primary care clinician. But you know, one of the things you're going to be looking for, you know, there are what we call home test kits. You actually can get a free COVID test kit. Sometimes at the library or call your health department and they can tell you where you can get those. These are, you know, yeah, the ones I've seen have been Abbott test kits. You do them at home. And what I would say is just you know, go to the library, get a couple of those for the family, so that in case you're quarantined or you have any concerns that you think you might need to get tested, you will have something, you know, something free. I mean, these are absolutely free tests that you can just keep inside your house, so that whenever you need to get tested, you can get tested. Okay, and so you want to do that. Number two, make sure you call your primary care clinician. You want to make sure that you're under the direction of a clinician, so that if things start getting worse, so you either shortness of breath, you're getting more fatigue, or anything of this nature, that there's someone that can kind of walk you through management at home. Yet again, like I said, the monoclonal antibodies are important, and steroids and antibiotics. These are some of the things that some of the primary clinicians are writing for in terms of outpatient management of people infected with the virus that causes COVID-19. Okay. All right. And next slide, please. Okay. All right. So some of the other things that you're going to want when you're managing things at home, and honestly, these are some things you might just want to have anyway. So one of the things is a pulse oximeter. So like I said before, the virus that causes COVID-19, one of the things that it really interferes with is your ability to breathe. And so one of the things you want to have is a pulse oximeter, so that whenever you call your primary care clinician or even just kind of monitoring yourself at home, you know, you can put this. It's a little device that you put on your finger, and it tells you how much oxygen you have and it's circulating in your blood. You know, of course, anytime you go to a clinic and stuff, they're doing it anyway. But you want to keep one of these at home. They're usually fairly inexpensive, so that if you do get infected, you want to be checking this probably a couple of times a day. You know, just see how many times your clinician wants you to do it, and just watching to see if that oxygen level goes down. One of the things people usually advise you to do is to, you know, getting it while you're sitting is one thing. You know, you might want to walk around with it as well and see if that number goes down, and be prepared to tell your whoever is managing you, you know, what if that number drops down. Because if it, you know, if it goes from 97 to 95 is one thing, but if it goes from, you know, like I said, 92 to 88%, you know, that might mean something different to a clinician. You know, I usually tell people blood pressure cuff. Of course, I'm a hypertension specialist, so I think everybody needs to have a blood pressure cuff at home. Thermometer, which is something, you know, most people should have anyway. And so you want to keep all of those things. And you know, we need to ignore that. All right. Okay. All right. Next slide, please. Okay. So now, in terms of, you know, before we get back to those little controversial issues and answer questions, I do just want to kind of talk about, in general, how to deal with some of the things that are going on with COVID-19. As I said before, it's one of the comorbidities that seem to do one of the comorbidities that seem to not do well with infection with the virus that causes COVID-19 is obesity. So what you want to make sure that you start doing, if you're not doing already, is getting kind of an exercise routine. You know, like I said, you know, even if it's just like I even tell people, even if it's just like a simple walk. And you know, and what this does is a couple of things. Number one, you want to start, you know, being a little more healthy. Number two, there are some studies that say that individuals that are exercising, um, that it has a protective effect from being infected with the virus that causes COVID-19. So, of course, it's not as strong as, of course, vaccination, but there is a protective effect that seems to be there. So I usually encourage people to, even if you're not active already, go ahead and start getting active. And like I said, that activity doesn't have, you don't got to get a home gym, you ain't got to get a membership of Southern Nature. Get a good, like I said, as long as you otherwise are healthy, talk to your primary care clinician, make sure you get a clearance. A good set of tennis shoes, walk around, like I said, walk around your neighborhood, walk around the mall, get a friend or two and just kind of go for a stroll, 6 feet, of course. And get that extra, start some sort of exercise routine, so that you can maintain your health, just kind of in general. But like I said, this is a really good motivator, because like I said, the folks that are exercising seem to do a little bit better, when they get when and if they get infected with the virus. Healthy eating, yet again, this helps you with maintaining, and preferably, if your BMI is elevated, also, kind of losing weight. Some people consider the supplements. There's no sort of, randomized trial or anything of that nature that say that vitamin C works. However, some people do like a little bit of vitamin C, a little bit of zinc, of vitamin D. Vitamin D does seem to be pretty helpful. And so those type of supplements can be considered. And decrease stress. In general, stress kind of suppresses your immune system. So you want to make sure that you're decreasing stress during this pandemic. And yet again, going back to the exercise helps relieve stress. A walk a day helps relieve stress. And like I said, if you don't have anybody to walk with, and like I said, you walk by yourself, sometimes you can just either put some music on. I know, honestly, what I was doing for a while, I was getting the Bible app and letting it read me, read some of the Bible, while I was walking. But you definitely want to find ways to decrease stress, during this pandemic. All right, next slide, please. Another thing I want to point out during this pandemic is do not delay your medical care. What we're finding is, and this was happening actually during the summer, even before the surge happened, is that a lot of people were, of course, scared to go to the doctor and things of this nature, in 2020, and then they tried to go get their appointments all in 2021. Well, what happened is that everybody's kind of do this at the same time. At the same time, everybody, we have a normal number of people that get sick anyway. And so what was happening is that there was a delay. Even when I tried to get, I think I called late 2019 to get my primary care appointment, and it was the next appointment they had was June. And this just continued throughout the year, where it takes you a long time to get appointments, whether it's primary care specialists and things of this nature. So I would say, like I said, I know people are concerned about coming out and going places, but at the very least, make an appointment. A lot of clinicians are doing telemedicine. So if you have an established relationship, you may be able to just get away with, either a FaceTime call or some sort of telemedicine call, while you're at your house. And that way, at least there's somebody keeping on top of whatever chronic disease or whatever issues you may have. If you don't have a primary care clinician, I would say, it's a prime time to go ahead and sign up for one. Even if it's 4, 5, 6 months out, at least you will have an appointment that you can be moving towards. So I always tell people to go ahead and do that. And kind of like I said, schedule your appointment, schedule your appointments early. If you don't have a primary care clinician, make sure you get one. And then, like I said, don't delay your care, because, like I said, if you have something going on, it may take a while for you to get in. Like I said, in a situation like, where everything is getting busy, like we're seeing right now, sometimes it's hard. Like I said, you don't want to put off something that's preventable, wind up with something urgent, and then now you got to go to an emergency room. And if you go to the emergency room right now, you're waiting for hours. And like I said, and a lot of some of these hospitals, I mean, you won't make it up to a bed. You go to ER, you need to be admitted. You may sit in the ER for a couple of days. So you don't want to do that for something that may have been prevented ahead of time had you just kind of followed up with your regular clinician. So I know things are, they're scary and sometimes they get scarier. But like I said, we want to be a little prudent about our healthcare and try to prevent catastrophes, or can prevent emergencies from happening. Okay. All right. And next slide, please. Okay. And one of the things, of course, I think that this just seems to be everybody. I mean, there's a mental health component to the pandemic. There's part of it's grief, because we've essentially lost, our way of life. And like I said, for some people, the fact that you're seeing these numbers and stuff going back, it's probably almost post-traumatic. It's kind of like, oh my God, it's happening all over again. So you definitely want to make sure you protect your mental health during this period. It's very important, to learn to accept the things. You cannot change the things you can, and that wisdom to know the difference between the two is important. One of the things I tell people to do, number one, is to cut the television off. If there are things that you can't control, just cut the TV off. There's no need you're worried about it. Because I find a lot of people are worried about stuff, and it's like, okay, well, how about you cut it off, get you a good book, a cup of tea, and just let yourself calm down. Because like I said, yet again, if you are watching things that are making you stressed, that constant stress has a negative effect on your body. Your blood pressure goes up, your heart rate goes up, your immune system gets affected. So you want to make sure you protect that mental space while during this pandemic. And like I said, sometimes that's a matter of ignoring things, or avoiding things that are the source of that stress. Okay. So yeah, again, you go back to that walking. Walking is like just I tell folks, it's just a great way to calm down at the end of a day. Sometimes I do it. Like if I have a long day today, I will probably go home, put on a pair of tennis shoes, and do like I said, walk around that neighborhood in order to just kind of clear my space, clear my head space. And it also, kind of helps your body, it helps your body as well. Reading, a lot of times reading, like I said, if you can get immersed into a good book, find you a good article, it allows you to, number one, you can learn some things. Because sometimes reading about other people's lives is can be refreshing, or at least give you another perspective. Then like I said, laugh. Call a good friend that can make you laugh, or something of nature. Have those conversations. And then, like I said, also visit. Like I said, try to not avoid visiting, family and friends. Like I said, maybe smaller gatherings, but like I said, you want to make sure you keep those connections going. So those are kind of some of the important pieces of this. Because like I said, this is at this point in time, I think that, that little window, that little, light at the end of the tunnel looks like, it's just another train coming. So it looks like we're going to be doing this for a while. And honestly, at this point in time, some of the thoughts are that this disease is probably going to become endemic. And what that means is that it's just going to be cyclical, kind of like our other viruses. And if that's the case, like I say, we have to see, what we're going to wind up doing. Does this mean, multiple vaccinations? Does will it get worse? Will it get better? Will it change, from year to year? So, so many things like I said, right now, this is a disease that, as far as we know of, is less than 2 years old. And so it's going to take some time in order to figure all this stuff out. So I would say, like I said, definitely make sure you take care of yourself, physically, mentally, spiritually, as we kind of go through this walk, basically together. Okay. So, and I think that's pretty much it. We can kind of open this up for questions, concerns, comments, anything of that nature.
Yeah, we got some questions in the chat, that's for sure.
Uh-oh.
And I just want people are like, okay, I got questions. But before we even go to the questions, I do want to say that I like you're stopping there at the last to talk about mental health, because that's extremely important. And we do allow, I know I have some friends who, I saw on CNN and I was watching it all last night. I'm going, stop.
Cut it off.
You don't want to do that, because you are stressing yourself out, and it does affect you. You don't think it does, but even hearing it in the background can be very effective too. So yeah. So the first question we have is how long do the spike proteins stay in our bodies?
So spike proteins itself won't stay that long because your body you will clear it. At least that's in theory that's how this thing works. So your body's supposed to clear those spike proteins out, and what happens is that you have an immune response. So the way your normal immune system works, and this is if you ever get exposed to to any sort of foreign entity, like I said, a virus, bacteria, is that your body is able to get a piece of that. And like I said, there's certain cells they actually call memory cells within your body, and they will produce these things called antibodies, which can kind of recognize those. But the goal is not for them to that spike protein itself to kind of stay in there. You're supposed to clear that out.
Okay. Yeah, that's been a big question, the antibodies. A lot of people don't understand how that works. There's
Mm-hmm.
others I've talked to who said, I think I still have antibodies, but how would you know?
So the only way to know if you have antibodies is to go get a lab test to see if you still have antibodies. If people may be familiar or recall what we call titers. So like there's certain, like I said, if a lot of times we get vaccinations when we're young, and maybe before you went to college, or like I said, I think like military folks, they'll draw blood and they'll check something called a titer. And what they're looking for is signs that your body remembers those vaccinations that you've had before. And if those quote unquote titers are not at a certain level, they actually give you a new shot in order to get them back up. Is the idea. And so the same concept for here, except we don't really have titers, and you can go, have someone draw, or they can get a lab to draw the antibodies to, COVID, the virus that causes COVID-19. It's not, there's not a recommended level that we have right now. So I think that part is under investigation. But for those who, I know when we were first getting the vaccination, there were some of the physicians that were going out and getting, just a lab drawn, and it was just more of a curiosity just to see what was going on there. And so, so that can be done. You can talk to a clinician to see if they will draw those. I think some labs may just, if you say you want it drawn, they may just draw it for a cash price. I'm not sure. I'm not sure which ones, but you can probably, ask around and find those. But that opportunity is out there. But yeah, right now, there's not a specific, a specific timing of checking antibodies, or a recommended interval for checking antibodies.
Okay. Gotcha. The next question is, should we be wearing FFP2 or FFP3 masks now?
I'm not sure what those are. So the ones I'm
Okay.
familiar with are like I said, we got, the regular surgical mask. We got the KN95, which is kind of the non-hospital grade N95 mask. They're supposed to be fairly similar. Like I said, the nano, kind of nano filters is what they call them. Now there are other. I mean, I'm sure there's a host of other masks that are out there. So I'm not sure if she's thought if this might be like a little more intensive mask or something of nature. But for the most part, okay. So and part of this depends on where you're going and what the situation is. So like even in the hospital, you know, and which is where you got we're putting all the people with COVID. If I'm just going into the regular clinic where this person doesn't have the symptoms of his nature, we typically are just going to wear a regular surgical mask, for just walking around the hospital, and just seeing what we call regular patients that don't have symptoms or diagnosis of COVID-19. Now, if there's a patient that has a diagnosis of COVID-19, then we step it up, and then we are going to use the N95 mask with a shield, or we're going to use what we call these things respirators. And I don't know, maybe this is what she was referring to, where it's like, kind of an enclosed, Darth Vader helmet type device, which is kind of a enclosed thing that gives you kind of a more highly filtered or purified air airflow is what goes on there. So that's how when we walk into those rooms, that's what we use. But for the general public, for the most part, you can get away with just a surgical mask, or like I said, a multi-layered homemade mask. Some of those will do as well for unless you're in a crowded area or something of the nature.
Gotcha. Should we be wearing masks outside?
So I haven't seen anything where, anything consistently, I'll put it that way, that says you should be, that you have to wear masks outside. Now, granted, if you were at Lollapalooza, they probably would have benefited from a mask. However, the for the average, like I said, your average stroll around the neighborhood, then usually if you're outside and you're getting good ventilation, those people typically will not need a mask. Especially if if you're just kind of with the people in your household, or just like a small, a small gathering of people, that ventilation alone usually is good enough.
Okay. Can you speak on the MU virus, or the MU virus, and or any other variants?
Okay. So that's actually a really good question. So what we have, so I guess let's talk about a little bit about variants in general. So basically, the SARS-CoV-2, this particular coronavirus, these things mutate quite a bit. And so what we're seeing now is that we're getting variants that are coming, that are just kind of out there, that are within the U.S. We have variants of interest. So there's the alpha, which was the first one to hit us, which pretty much hit everyone. But there's a beta and a delta, and I think gamma is out there as well, like 4 variants of interest that are circulating in the U.S., with alpha and delta being the biggies. And so basically, these have just minor changes on them, so that they may they may behave a little differently. Like the delta is supposed to be a much more transmissible virus. So, whereas, and we're seeing this some in the health department, where, before a person would be infected, and maybe if they were around 10 people, maybe 1, maybe 2 other people would get infected. And like with the Delta variant, you're seeing where, it may be 4 or 5 people that get infected. We're seeing increased transmission within the household. Sometimes with the original variant, one person will be sick, nobody else is sick. Like now we're seeing, like I said, everybody in the house gets sicker. So every time they have a variant, they have to watch it to see what its behavior is going to be. Number one, see what behavior is going to be. Number two, we have to see whether or not our, what we call our medical countermeasures are going to work with it. And so, like I said, whether or not this vaccine primarily is going to, help you to deal with the variant. So right now, like with the Delta variant, my last recollection is that I think, the original efficacy of the vaccine was, I think, 95, 96% against the first variant, but only like 88% against the Delta variant. And then, like I said, these other variants, as they come through, you got to see whether or not, it's going to maintain that level of, strength or immunity against the various variants that we see. And same thing with the monoclonal antibodies. So there was like I said, as it changes, even though there's subtle changes, those monoclonal antibodies may not work as effectively, in which case, they'll have to change the design a little bit as well. So.
So it looks like we may be going down the path of having to get a booster sooner than later.
Yeah, so the boosters, and I guess probably what we should do is clarify. So there's, so what they're talking about now is really a third shot. I think it's commonly called a booster, but it's really just a third shot of what we've already had before. And the theory being that, like I said, we get that third shot, it'll take that immune system up. I think they're still trying to sort out whether or not that is going to work. And how well it might work. So like I said, I think they're still working on that piece. My understanding from I think it was an article I read about a month ago, is that, at least Moderna, I'm sure Pfizer is doing it as well, is working on what will be a true booster, where it's a little more specific to some of the variants that are out there. So this third shot would be just the same. It'd be the third of the same shot that you've had before. And the conversation, like I said, the conversation can be a little confusing because like I said, there'll be someone mentioning, oh, the boosters are coming. Oh, we're not going to get a booster. So I understand a lot of that confusion, but at this point in time, the only people that this third shot is recommended for is for those individuals that are immunosuppressed.
Okay.
And granted, even with that though, it is a kind of a self-declaration. So if you walk into a place that is giving vaccines, you know, technically speaking, nobody checks. You if you sign, nobody checks to confirm, what you actually have. So they'll put a statement there. You got to sign, but there's nobody checking. So because I've known some people that have, shall we say, bypassed. They've gone to get a shot.
Yeah.
So that's for some of the people. Like I said, it's just kind of it is one of those things. But like officially, there's not an approved regimen or an approved third shot or booster shot for the regular population.
Gotcha. So, Dr. Brown, what would you say to a person who is still, hesitant about getting the vaccine?
Woo, that's tough. So because I'm still running into those. So those individuals that are concerned about vaccines, so I'm seeing I guess they fall into a couple of different camps. So one is just the individuals that just really are not, can I say, concerned about COVID. Honestly, I mean, they think it's just a regular flu, or regular flu conspiracy things of this nature. And even at this day and time, despite what everybody's seeing, they still are just not concerned about it. Like I said, for some of the younger folks, I mean, I can kind of understand that because I mean their numbers and the number of them that get severely affected is a lot less. And I think that in youth culture in general, they just don't think anything's going to happen to them. So some of that to understand. The older ones is a little difficult to understand because you got an 80-year-old that that still doesn't think it's right. It's kind of interesting to kind of wrestle with what's going on there. So there's the ones that don't think that so there's the ones that don't think that the virus itself is severe or real or anything of that nature. So you got those people, and then you got people that have questions about the vaccine. I mean, so the long-term data stuff. I'm like, well, it's the virus is new. You can't. I mean, 2 years. That's all we got. So that's all we have. And for yet again, as I talk to older folks with comorbidities, I'm like, hey, this is for you. This is this is literally for you.
Yeah.
And just trying to try to make sure that they understand what's happening. And it's kind of interesting because I have seen families where the family comes in sick, one or two people pass away, and they still are, hey, I've heard everything you got to say. I'm still going. I'm like, okay, all right, that's interesting. But more often, what you find, and it's not just with this virus, it's with a lot of diseases and disease processes, is that I don't think people really understand the gravity of what they are essentially deciding. And so, I do dialysis, and of course we see a lot of people with heart conditions, and of course we see them before they get on there. And maybe it's diabetes out of control, maybe it's high blood pressure out of control, and you're telling them, hey, look, we need to get this under control, otherwise you're going to have a heart attack, you're going to be on dialysis, things of this nature. And like I said, some individuals, they go through it, and like I said, when it's time to get that dialysis, they just go in and they find or whatever. But a not small percentage of these people, of individuals, as the reality of their consequences comes about, whether you're holding your chest because they get a heart attack, or I'm about to, hey, I'm putting these acts, I'm putting you on dialysis. It hits you different. And what I
Mm-hmm.
strive to do is to make sure that individuals understand, like I said, this disease, like I said, in this particular thing, this disease is different. It just is. And you can talk this, but like I said, this is a disease that affects your lungs. So
Right.
you're basically kind of, it affects everybody a little differently. But if you are that person where it affects you and you can't breathe, it's a you know it, you talk about a come to Jesus moment. Like,
Yeah.
it's
Yeah.
it's really tough. And it's like, I've seen some,
Mhm.
of course you've seen the physician, like, oh, we should have got, like, I don't do that type of stuff, because for me it's I'm very empathetic, especially with us, because we have a
Mhm.
history of distrust, and that history is real, and that history is
Yeah,
real. And
it's
so I
real.
can understand
Mhm.
where it's real, and I can understand where they're coming from. But it's like making sure that you understand that this disease is different. And I understand your
Mhm.
your concerns about the new virus, but the new vaccine, but you got to understand the virus is new too. And
Mhm.
it's making sure that you understand that, like I said, if you make a decision not to get this, and you acquire this virus, and you're one of those people that you fall into that, and that group of people that have a bad outcome from this, it is, there's not a lot we can do. And it's a hard way, and I, watching folks, it's a hard way to go. It truly is.
Mhm.
And so, just
Mhm.
making sure folks know this, make sure they know, why they're doing it. And like I said, if you're a person, I'm an informed consumer, I guess. I'm gonna provide you the information, and if you decide not to, I don't browbeat. I don't browbeat, but I will
Right.
remind you
Right.
multiple
Mhm.
times, and like, hey, look, I'm telling you, like I said, I went and got mine.
Mhm.
But
Yeah.
just making sure yeah, make sure people understand, what this is, and like I said, what's going on there. So it's so that's where that comes from. But like the hesitancy, the people that are hesitant, like I said, some of them, like, and the other thing is this, like I said, if I find out you're hesitant because you think there's a microchip in it, not those people, I got you. Like, there is no microchip. I got you. So those I can help. But some of the ones that are concerned because of this, like I said, extrapolation of the historic distrust, you just try to make sure that you understand, like, hey, I understand that piece, but I don't want you, suffering unnecessarily,
Mhm.
because of, some, information that may be correct, but you still got to walk this walk. So,
Right. Right.
yeah,
Okay. Thank you.
you're welcome.
The vaccine is here. It can help you protect yourself, and it can also
Hmm.
help you protect loved ones around you. I mean, I've
Hmm.
I've witnessed this myself, seen this where the decision is made, and then somehow you get COVID-19, you bring it home to your family or to your elderly grandmother or grandfather, and then they're not here. Within the month, they're gone,
Yeah,
and
yeah,
that's a decision that you're making, that not just for yourself, but the people around you as well. So
yeah.
I just wanted to make that
I
statement. Thank you.
yeah.
Oh, go ahead.
And, and I would agree with that. I mean, like I said, I think that, understanding what this is and what you're doing is huge, especially for those individuals that are choosing, and really you're choosing to stay out there. Because, like I said, there are individuals that are, staying, like they don't want it for religious reasons, but they're staying careful. You're not going out in crowds and stuff of nature, but like the individual, like if you're out there, this vaccine, you need the vaccine. I mean, Jesus,
Mhm.
like, yo,
Mhm.
you're going to bars and
Mhm.
clubs and stuff of that nature, and like you said, if you're multi-generational and you're coming back home, whew, it's tough. It's tough. I'm telling you, like you said,
It's
you'll be
really
burying
tough.
someone. Yeah, exactly.
Absolutely.
So,
Yeah, yeah. And I'll just say one last thing. I know we need to wrap up, but
okay,
there's a lot of people, if you're going, this summer we had this sort of hope. Oh, it might be over. And
exactly.
people are not wearing their masks. I'm in the stores and
Yeah,
I'm walking around, and you looking around, and there's a large number of people who are not wearing their mask at all. And even if you're vaccinated, you still need to realize that we're not out of the woods yet. So let me ask
Yeah.
you, Dr. Brown, if you have some final remarks, and then we're going to wrap up
Okay.
for the evening.
Okay. Well, like I said, yet again, thank you once again for allowing me to come here and have this conversation. I really, I enjoyed the presentation. I enjoyed the questions. They were really insightful and thoughtful questions. I think final thoughts for the folks out there is number one, make sure you're getting really good, solid information. As you make decisions, because like I said, this is going to be a long term. What it's looking now, this is going to be a long term battle, really, with this virus that is probably going to alter, the way we live for a long, actually probably forever. In addition to that, like I said, make sure you're being safe. Make sure that you're, like I said, taking appropriate precautions. But also make sure you take care of yourself, your family, your friends. Make sure you keep those connections reach if you need to, even if it's virtually or by phone. Like I said, I think with the way this is working, it can cause a lot of stressors, and it can cause a lot of separations. But make sure you maintain those connections, maintain your physical and mental health. And like I said, we're in New Salem, so like I said, make sure that we do that connection with the Creator, with our God, so that like I said, to help you to be able to navigate this, because like I said, remember, like I said, this is bad, but like I said, you read the Old Testament, you realize they were plagued before, so we had to get through those too.
Amen.
So make sure
Amen.
you stay safe and protect yourself and stay blessed.
Excellent. Well, thank you so much for joining us tonight, Dr. Brown. So glad to have you back again. We'll probably have to have you back another time to give us another update on where we're at, which is so helpful, and we really appreciate it so much. So thank you so much. Thank you, everyone, for joining tonight. And I just want to say, hey, stay safe and stay healthy. Talk to you soon. See you later.
All right. Bye-bye. Take care.